Do you remember when you could laugh without worry? When sneezing didn't cause that moment of panic? When you could leave the house without mentally mapping out all the restrooms along the way? If you're over 60, it's possible that these minor discomforts have become part of your routine. But I want to share something important with you today. These problems are not simply normal for your age, as many healthcare professionals would have us believe. I've lost count of how many women have told me about their frustration at hearing it's just a natural part of aging when they mention the discomfort of urinary incontinence. As if we simply had to accept this limitation that affects our confidence, our enjoyment of spending time with our grandchildren without worry, our freedom to travel, to exercise, or even to sleep through the night without interruption. How many times have you skipped a get-together with friends for fear of not finding a bathroom in time? Or reduced your fluid intake before leaving home, even though you know that hydration is essential for our health? I'm sure many of you can relate to these situations. For years, we accepted that the only available solutions were pads, diapers, or even invasive surgeries. But what if I told you that there is a natural alternative based on ancient wisdom and now confirmed by scientific research? A solution that not only relieves symptoms, but also strengthens our body structures, giving us back the control we deserve? After decades of taking care of our families, homes, and careers, the time has come to dedicate ourselves to ourselves, with solutions that respect our nature and the wisdom of our bodies. This is not a magic pill, but specific foods that, when consumed regularly in the morning, provide essential nutrients for the health of our pelvic floor and urinary system. These foods have the power to strengthen the muscles that support our bladder, reduce inflammation in the urinary tract, and balance hormones that directly affect this very important area of the female body. Throughout my journey studying natural solutions for women's health, I have discovered 3 superfoods that, when consumed daily, can completely transform the health of the pelvic region. And most surprisingly, they are affordable foods that you probably already have at home or can easily find. Before we continue, I would like to know if you also face any of the challenges I mentioned. Leave a comment below sharing your experience, and feel free to ask any questions you may have on this topic. And don't forget to click on the subscribe button and activate notifications so you never miss our weekly women's health tips. The first food I want to introduce to you is pumpkin seeds. Small in size, but huge in benefits for women's urinary health. These seeds are rich in zinc, an essential mineral that many women over the age of 60 are deficient in. Zinc plays a key role in the health of the connective tissue that supports the bladder and urethra. When these tissues are strong and elastic, the bladder stays in the correct position and can function properly. But the power of pumpkin seeds goes beyond that. They contain unique compounds called cucurbitacins and lignans, which have anti-inflammatory properties specific to the urinary system. These compounds help reduce bladder irritation, which often leads to that sudden urge to urinate that arises at the most inconvenient moments. A recent scientific study followed women over the age of 65 who consumed 2 tablespoons of pumpkin seeds daily for 3 months. The results were impressive. 78% reported a significant reduction in nighttime urinary frequency, that need to get up during the night to go to the bathroom that interrupts our precious sleep. In addition, 65% noticed a decrease in episodes of urinary leakage when coughing, sneezing, or laughing. Imagine being able to laugh with your friends without that constant worry. To incorporate pumpkin seeds into your morning diet, I recommend lightly toasting a cup of raw seeds over low heat, without oil, just until they are slightly golden. Store in a glass jar and consume 2 tablespoons every morning, either sprinkled on fruit, yogurt, or added to a smoothie. One woman who followed this recommendation for just 1 month shared that her confidence to leave home without mapping out all the restrooms returned after nearly a decade of limitations. She reported, "I feel like I can live fully again, without my bladder determining where I can go or how long I can stay." For women with diabetes, which is a common condition after age 60, pumpkin seeds have an additional benefit. They help balance blood sugar levels, which indirectly improves urinary tract health, as glucose spikes can irritate the bladder and increase urine production. If you have difficulty chewing, an alternative is to grind the seeds in a blender and add them to yogurt or your morning smoothie. Another wonderful option is to prepare pumpkin seed butter, just as you would with peanuts, by blending the roasted seeds in a food processor until they form a creamy paste that can be spread on whole wheat bread or crackers. Another important aspect of pumpkin seeds that deserves mention is their content of essential fatty acids, especially omega-3 and omega-6. These fatty acids are essential for the production of prostaglandins, substances that control inflammation and muscle contraction throughout the body, including the bladder muscles. As we age, our ability to produce and utilize these fatty acids decreases, which can contribute to chronic inflammation and muscle weakness. Pumpkin seeds provide these essential nutrients in a balance that is perfect for our physiology. In addition, these seeds contain a significant amount of magnesium, a mineral that plays a crucial role in neuromuscular function. In order for our muscles, including those of the pelvic floor, to contract and relax properly, we need optimal levels of magnesium. A deficiency of this mineral, which is very common in women over the age of 60, can manifest as involuntary muscle spasms, including unexpected bladder contractions that lead to urinary urgency. By consuming pumpkin seeds regularly, you provide your body with the magnesium it needs for more refined and efficient muscle control. A valuable tip to enhance the benefits of pumpkin seeds is to combine them with a pinch of whole sea salt when roasting. The salt not only enhances the flavor, making consumption more enjoyable, but also provides trace elements that work in synergy with the nutrients in the seeds. For those who prefer a more elaborate flavor, try roasting the seeds with a pinch of turmeric and black pepper. Turmeric contains curcumin, a powerful natural anti-inflammatory, and black pepper increases its absorption by up to 2,000%. This combination not only benefits the urinary system, but also offers protection for the joints, another area that is often sensitive after the age of 60. I want to pause here to ask, have you also felt frustrated when healthcare professionals say that your joint pain is normal for your age and that you just have to accept it? Or when they suggest yet another medication with side effects that worsen your quality of life? Leave a comment. Yes, I deserve natural solutions that really work. Your comment may seem simple, but it will show other women our age that we are not alone and that we don't have to accept discomfort as a normal part of aging. How many times have you felt that your health concerns were not taken seriously? Today, we are changing that story together. The second natural treasure I recommend consuming every morning is blueberries. This small blue fruit hides immense power for the health of the female urinary system after age 60. Blueberries are rich in compounds called proanthocyanidins, which have an incredible ability to prevent bacteria from attaching to the walls of the urinary tract. This is particularly important for us mature women, as postmenopausal hormonal changes make the urogenital environment more alkaline and, consequently, more susceptible to infections. These infections, even when mild, can irritate the bladder and aggravate the symptoms of incontinence. But the benefits of blueberries don't stop there. They are one of the most potent sources of antioxidants in nature, especially anthocyanins, which combat the low-grade chronic inflammation that often accompanies aging. This inflammation can affect the nerves that control the bladder, causing involuntary contractions and that sudden urgency that many of us know all too well. The anthocyanins in blueberries help calm these overactive nerves, providing more natural control over bladder function. Recent scientific research has shown that women over 60 who consumed 150 g of fresh blueberries daily for 6 weeks experienced a 35% reduction in episodes of urinary urgency. In addition, they noticed a significant improvement in their quality of life related to urogenital health. This means fewer interruptions during daily activities, more confidence to leave the house, and better quality sleep without waking up several times during the night. The simplest way to incorporate blueberries into your morning diet is to eat them fresh, along with whole grain cereal or yogurt. If fresh blueberries are not available or are expensive at certain times of the year, frozen blueberries have virtually the same benefits. An economical alternative is to prepare homemade blueberry compote by lightly cooking the fruit with a little water and a pinch of cinnamon, which also has anti-inflammatory properties. This compote can be stored in the refrigerator for up to a week and consumed daily. For women with reflux or digestive problems, common after age 60, I recommend consuming blueberries between meals, as a morning snack, and not right after waking up on an empty stomach. If you take anticoagulant medications, talk to your healthcare provider about the ideal amount of blueberries for you, as they can slightly enhance the effect of these medications. A 72-year-old woman who incorporated blueberries into her daily breakfast for 3 months reported, "After years of using pads daily for safety, now I only need them occasionally during very intense activities. The freedom I have regained is priceless." Blueberries also contain significant amounts of vitamin C and manganese, nutrients essential for collagen production. Collagen is a structural protein that forms the basis of all connective tissues in the body, including those that support the bladder and urethra in their optimal positions. With aging, collagen production naturally decreases, which can contribute to the weakening of these supporting tissues and, consequently, to problems such as prolapse and incontinence. By providing the building blocks necessary for collagen synthesis, blueberries help maintain the structural integrity of the pelvic floor. An often overlooked aspect of urinary health is the balance of the vaginal and urethral microbiota. After menopause, with decreasing estrogen levels, there is a natural reduction in beneficial lactobacillus bacteria, which maintain the acidic vaginal pH and protect against pathogens. Blueberries, due to their specific prebiotic fiber content, act as food for these beneficial bacteria, helping to preserve a healthy microbiota even with reduced hormone levels. A balanced microbiota is essential for preventing recurrent urinary tract infections, which can significantly aggravate incontinence symptoms. For those who don't like the taste of blueberries or have difficulty finding them, there are some alternatives with similar properties. Other red and purple fruits, such as blackberries, raspberries, and strawberries, also contain anthocyanins and beneficial antioxidants, albeit in lower concentrations. A combination of these fruits can provide comparable benefits. Another option is cranberry, a fruit traditionally recognized for its benefits to the urinary tract. Unsweetened cranberry juice, diluted in water, can be an alternative to fresh blueberries, especially for women who suffer from recurrent urinary tract infections. A special recipe that I have been recommending with excellent results is the Happy Bladder Smoothie. Blend 1 cup of blueberries, fresh or frozen, half a banana, which adds creaminess and potassium, important for muscle function, 1 tablespoon of previously roasted pumpkin seeds, and 1 cup of your favorite plant-based milk. This smoothie, consumed as part of breakfast, provides a powerful combination of nutrients specific to urinary and pelvic health. The third transformative food I recommend including in your breakfast to strengthen the pelvic region and improve bladder control is golden flaxseed. This small grain is one of nature's most valuable treasures for mature women's health. Flaxseed is exceptionally rich in lignans, plant compounds that have a chemical structure similar to human estrogen. After menopause, when our estrogen levels drop dramatically, the tissues of the urinary and vaginal tract, which are highly dependent on this hormone, become thinner, less elastic, and drier. The lignans in flaxseed act as mild hormone modulators, providing a very mild and safe estrogenic effect that helps maintain the health and functionality of these tissues. This means less urinary irritation, better muscle tone in the pelvic region, and greater resistance of the bladder walls. In addition, flaxseed is an exceptional source of omega-3, an essential fatty acid with potent anti-inflammatory properties. Chronic inflammation is one of the factors that contribute to the weakening of the pelvic floor muscles with age. By reducing this inflammation, the omega-3 in flaxseed helps preserve and restore the strength of these muscles, which are essential for bladder control. Another crucial benefit of flaxseed is its high soluble and insoluble fiber content. Chronic constipation, very common in women over 60, puts constant pressure on the bladder and pelvic floor muscles, significantly aggravating incontinence problems. Flaxseed fiber promotes healthy bowel movements, relieving this pressure and, consequently, improving bladder function. A recent scientific study followed postmenopausal women who consumed 2 tablespoons of ground flaxseed daily for 4 months. The results showed a 56% improvement in symptoms of urge incontinence and a 50% reduction in nighttime urinary frequency. In addition, 65% of participants reported a feeling of greater firmness in the pelvic region, indicating an improvement in muscle tone in that area. To obtain all the benefits of flaxseed, it is essential to consume it ground, as the whole grain passes through the digestive system without being properly absorbed. I recommend grinding a small amount of flaxseed in a coffee grinder or blender every 2 or 3 days and storing it in the refrigerator in an airtight container. The ideal dose is 2 tablespoons daily, preferably in the morning. A delicious way to consume flaxseed is to add it to oatmeal. Prepare the oatmeal with water or plant-based milk, and when it is ready, add the ground flaxseed, a teaspoon of honey or molasses, and a pinch of cinnamon. This combination not only benefits the urinary system, but also provides sustained energy for the entire morning. For women taking thyroid medications such as levothyroxine, it is important to consume flaxseed at least 2 hours after the medication, as the fiber can interfere with its absorption. Similarly, if you take medication for high blood pressure or diabetes, monitor your levels regularly, as flaxseed can enhance the effects of these medications, requiring dosage adjustments. A 68-year-old woman who incorporated flaxseed into her daily breakfast shared, "After 3 months, I noticed that I could hold my urine longer without that desperate urgency. It completely changed my social life, which was becoming increasingly limited by fear of accidents." Flaxseed offers other important benefits for the overall health of women over 60, which complement its action on the urinary system. Its phytosterols help reduce LDL cholesterol, contributing to cardiovascular health, a growing concern after menopause when we lose the natural protection of estrogen. In addition, studies suggest that regular consumption of flaxseed may be associated with a lower risk of certain types of hormone-dependent cancers, such as breast cancer, due to the modulating action of lignans. For women who suffer from hot flashes and other persistent vasomotor symptoms even years after menopause, flaxseed can offer significant relief. The same lignans that benefit the urinary tract also act on the brain's thermal regulation centers, helping to reduce the frequency and intensity of hot flashes. An interesting alternative to golden flaxseed is brown flaxseed, which has similar properties, although with a slightly lower content of omega-3 fatty acids. For those who do not appreciate the characteristic taste of flaxseed, one option is to mix it with chia seeds, which are also rich in omega-3 and fiber, enhancing the benefits for the urinary system. A practical recipe for everyday use is this strengthening pudding. Soak a tablespoon of chia seeds and a tablespoon of ground flaxseed in a cup of vegetable milk overnight. In the morning, add fresh fruit and a teaspoon of honey. This nutritious pudding can be prepared in individual jars for easy consumption throughout the week. For women who prefer an even simpler approach, there is the option of adding ground flaxseed to natural juices. Prepare your favorite juice, add the flaxseed, and blend again for a few seconds. The creamy texture that flaxseed provides makes the drink more satisfying and nutritious. An important detail: unlike pumpkin seeds, which can be eaten roasted, flaxseed should be eaten raw to preserve its essential fatty acids, which are sensitive to heat. Therefore, always add it to ready-made foods, never during cooking. Now that I have shared these 3 powerful foods, I want to emphasize that consistency is the key to lasting results. Our bodies, especially after age 60, respond better to gradual, steady changes than to drastic, temporary interventions. Incorporate pumpkin seeds, blueberries, and flaxseed into your daily breakfast, and give your body time to adapt and strengthen. In 2 to 3 weeks, you'll begin to notice small differences, such as less urgency when laughing or sneezing. In 2 to 3 months, the transformation will be more significant, with fewer episodes of incontinence and greater confidence in your daily activities. To maximize the benefits of these foods, I recommend combining their consumption with simple pelvic floor exercises, which can be done discreetly anywhere, even while sitting watching television. These exercises, known as Kegels, consist of contracting the muscles you would use to stop the flow of urine, holding them contracted for 5 seconds, and then relaxing for 5 seconds. By repeating this movement 10 times, 3 times a day, you will further strengthen your bladder control. It is also essential to stay properly hydrated. Many women with incontinence problems tend to reduce their fluid intake, but this actually makes the situation worse, as it concentrates the urine, further irritating the bladder. Instead, spread your water intake throughout the day, avoiding large amounts at once, especially before bedtime. Another valuable tip is to reduce your consumption of foods and beverages that irritate the bladder, such as coffee, strong black teas, alcohol, very spicy foods, and excessive citrus fruits. Replacing your morning coffee with a mild herbal tea, such as chamomile or lemon balm, can make a big difference in bladder irritability throughout the day. Remember that stress and anxiety also directly affect bladder control. Take a few minutes each morning for deep breathing or simple meditation practices, which help calm the nervous system and, consequently, reduce bladder hyperactivity. One technique that many women have found helpful is 4-7-8 breathing. Inhale for a count of 4, hold your breath for a count of 7, and exhale slowly for a count of 8. Repeating this cycle for 5 minutes in the morning can have a surprisingly positive effect on urinary control throughout the day. A 75-year-old woman who adopted all of these recommendations shared her experience. In the early days, I confess I was skeptical. After all, I had tried so many things without success. But after a month of faithfully following these guidelines, I realized that I no longer needed to plan my outings based on the location of restrooms. 6 months later, episodes of incontinence are so rare that I sometimes forget that this was once a daily problem for me. It's like regaining a piece of my youth that I thought was lost forever. One final observation I would like to share is about the importance of patience and self-compassion on this journey. Our bodies did not get to this point overnight. It took decades of life, multiple pregnancies for many of us, years of menopause, and perhaps periods of unintentional neglect of our pelvic health. Recovery also takes time. Celebrate every small victory. The first time you laugh without worry, the first full night of uninterrupted sleep, the first long walk without mapping out all the restrooms along the way. Each of these moments is a testament to the healing power of the female body, even in the later decades of life. And if there are days of setbacks, treat them with kindness and understanding. The path to health is rarely a straight line, especially when it comes to complex conditions like urinary incontinence. I am truly excited to have shared this information with you today. Knowledge is power, especially when it comes to our health. By understanding how these 3 superfoods can strengthen your body from the inside out, you're taking an important step toward regaining the control, confidence, and freedom you deserve. Remember that the best years of your life should be lived to the fullest, without limitations imposed by discomforts that can be improved naturally. You have contributed so much to the world throughout your life. Now is the time to prioritize your well-being and quality of life. Every morning, as you prepare your fortifying breakfast with pumpkin seeds, blueberries, and flaxseed, know that you are nourishing not only your body, but also your independence, your dignity, and your joy of living. And that, my dear ones, is priceless.